When explaining medical procedures to animal owners, what are some key principles to ensure effective communication? How can misunderstandings be minimized, and what role does empathy play in this process? Answer: effective communication with animal owners involves several key principles: clarity, simplicity, empathy, and active listening. Clarity and simplicity: use language that is easy to understand, avoiding technical jargon unless the owner is familiar with it. This helps ensure the information is accessible. Empathy: showing genuine concern for the animal's well-being and the owner's feelings can reduce anxiety and foster trust. Expressing empathy helps build rapport and ensures the owner feels supported and valued. Active listening: pay attention to the owner's concerns, questions, and emotional state. Respond appropriately to ensure they feel heard and understood. Minimizing misunderstandings: summarize key points at the end of the conversation and ask the owner to repeat the information to confirm understanding. Written instructions for home care or follow-up procedures should also be provided. The Australian Code of Practice for the Welfare of Animals emphasizes that professionals must maintain clear, honest, and compassionate communication with clients, ensuring they understand the care process and potential outcomes. Mr. Carter comes into the clinic visibly upset as his pet dog has been diagnosed with a chronic illness and treatment costs are higher than expected. He demands a discount. How should you approach the situation to maintain professionalism while addressing his concerns? Answer: when handling a difficult client situation like Mr. Carter's, it is crucial to remain calm, professional, and empathetic. Empathy and active listening: acknowledge Mr. Carter's emotional distress by saying something like, "Well, I understand how concerning this must be for you." Listen actively to understand his full concerns. Provide transparent information. Explain the rationale behind the treatment costs and the value of the proposed treatment. Make sure to clearly outline what the costs cover, including any long-term benefits to his pet's health. Offer alternatives. If a discount is not possible, offer alternatives such as payment plans or suggest less expensive treatment options if available. This shows flexibility and willingness to find a solution. Professionalism: stay focused on the animal's health and well-being and refrain from engaging in any emotional argument. Uphold the clinic's pricing policies while showing compassion. Referral: if necessary, refer him to a practice manager for further assistance, but reassure him that the pet's best interest remains the primary concern. How can a veterinary technician ensure that pet owners fully understand the aftercare requirements for their pet following surgery? What strategies should be used to confirm understanding? Answer: to ensure owners fully understand aftercare instructions. Written instructions: provide clear written instructions detailing medication schedules, wound care, dietary restrictions, and signs of complications. This is essential as clients may forget details after a stressful experience. Verbal explanation: in addition to written instructions, explain the aftercare procedures in simple terms. Break down each step and emphasize key points such as medication dosages or when to return for follow-up appointments. Ask for confirmation. Encourage the owner to repeat the instructions to ensure they understand. This also gives them an opportunity to ask questions. Contact information: provide a point of contact for the owner in case they have questions or need assistance. Follow-up call: schedule a follow-up call to check in on the pet's progress and answer any remaining questions. This builds trust and reassures the client. The Animal Care and Protection Act reinforces the importance of ensuring owners are adequately informed about the care required for their animals, particularly after medical procedures. Why is it important for students to complete work-based learning assessments in animal care, and how do these experiences help students develop real-world skills? Answer: work-based learning assessments are crucial in animal care education as they provide students with opportunities to apply theoretical knowledge in practical settings. Skill development: through hands-on tasks such as animal handling, care, and hygiene, students refine their skills in a real-world environment, which enhances their ability to perform tasks independently. Problem solving: work-based learning allows students to encounter and resolve issues they may not have anticipated in a classroom setting, fostering critical thinking and problem solving. Feedback and improvement: supervisors and mentors provide feedback, which is essential for personal growth and professional development. This allows students to identify strengths and areas for improvement. Assessment of competency: work-based assessments offer a more comprehensive evaluation of a student's readiness for the field. Practical tasks and direct observation help assess competency in areas such as animal care, medication administration, and record keeping. Describe the key steps involved in safely restraining an animal for examination. What precautions should be taken to prevent injury to both the animal and the handler? Answer: when restraining an animal for examination, the following key steps should be taken to ensure safety. Assess the animal's behavior, evaluate the animal's temperament before attempting restraint. Aggressive or fearful animals require different strategies than calm animals. Select the appropriate restraint method. Use the least restrictive method that ensures the animal's safety while allowing the handler to perform the necessary procedure. For example, a soft leash may be sufficient for a calm dog, while a muzzle and additional handlers may be necessary for an aggressive dog. Use proper restraint equipment. Use equipment such as muzzles, leashes, or harnesses appropriately to avoid injuring the animal. Ensure the equipment is fitted correctly to avoid discomfort. Calm the animal. Speak softly to the animal to calm it and use gentle handling techniques to reduce stress. Always avoid sudden movements that might startle the animal. Safety precautions for handlers. Handlers should wear protective gloves if necessary, particularly when handling animals that may bite or scratch. Ensure that the animal's head is always controlled to prevent sudden movements. What role does empathy play in customer service within animal care settings, and how does it contribute to building strong client relationships? Answer: empathy is critical in customer service as it helps professionals understand the emotional state of animal owners and respond appropriately, understanding client needs. By showing empathy, care staff can understand the emotional connection clients have with their pets, enabling them to offer more personalized and compassionate care. Building trust, clients are more likely to return to a clinic where they feel understood and supported. Empathy fosters trust, which is essential for long-term client relationships. Effective communication. Empathy allows staff to communicate more effectively during sensitive situations, such as explaining a pet's terminal diagnosis or discussing costly treatments. Conflict resolution. In difficult situations, empathy helps de-escalate tensions and promotes collaborative problem-solving. Clients are more willing to accept solutions when they feel their concerns are genuinely heard. The RSPCA Code of Practice encourages practitioners to approach all client interactions with empathy and professionalism to promote positive relationships and ensure the welfare of the animals. Why is it important for students in animal care programs to regularly reflect on their learning outcomes, and how does this process support professional growth? Answer: regular reflection on learning outcomes is essential for the following reasons: identifying strengths and weaknesses. Reflecting on practical experiences helps students assess their current competencies and identify areas that need improvement. Continuous improvement. Reflection encourages a mindset of lifelong learning as students can recognize what works well and what does not. This leads to constant self-improvement and skill refinement. Goal setting. Reflection allows students to set achievable goals for future learning and professional development. This helps them stay focused and motivated throughout their careers. Critical thinking. By analyzing their experiences and decisions, students develop critical thinking skills that are essential in real-world animal care situations. The Australian Qualifications Framework Act emphasizes the importance of reflective practices in vocational education to ensure that students continuously improve and develop as professionals. What key factors should be considered when providing aftercare instructions for an animal recovering from surgery? How can follow-up procedures be communicated effectively to ensure successful recovery? Answer: aftercare instructions should be comprehensive and clear to ensure successful recovery. Key factors to consider include medication and dosage instructions. Specify the exact dosage, frequency, and duration for any prescribed medication. Ensure the owner understands how to administer it. Wound care. Explain how to monitor and care for surgical sites, including how to clean and bandage wounds if necessary. Dietary restrictions. Outline any changes to the animal's diet post-surgery, such as restrictions on food types or feeding schedules. Behavioral changes. Advise the owner on possible behavioral changes, such as reduced activity, and how to handle these changes. Follow-up appointments. Clearly specify the date and purpose of follow-up appointments. Encourage owners to contact the clinic if they notice any concerning symptoms. Effective communication of these instructions can be achieved through a combination of written handouts, verbal explanations, and visual demonstrations if necessary. What are the key benefits of using real-life settings for work-based assessments in the animal care industry, and how do these settings improve student competency? Answer: work-based assessments provide several advantages in developing competency. Real-world experience. Students are able to apply theoretical knowledge to actual situations, reinforcing learning and enhancing skill development. Feedback opportunities. Students receive immediate feedback from supervisors and peers, allowing for quick adjustments and improvements. Professional behavior development. Exposure to real-world scenarios helps students develop professional behavior, including time management, teamwork, and effective communication with clients. problem solving. Students encounter a variety of challenges in work-based settings, allowing them to apply problem-solving techniques and build confidence. These assessments align with national training packages (NTP), which advocate for competency-based training that integrates practical experience into the learning process. Sarah, a student in an animal care program, is asked to complete a task involving administering medications to a dog recovering from surgery. What key considerations should she keep in mind to ensure the task is completed correctly and safely? Answer: Sarah should keep the following key considerations in mind. Proper dosage and medication. Ensure the medication is the correct one prescribed for the dog's recovery. Verify the dosage and administration instructions, including timing. Monitoring for reactions. Observe the dog for any immediate signs of adverse reactions, such as vomiting or lethargy, and report any unusual symptoms to the supervisor. Safe handling. Use appropriate restraint techniques to prevent injury to both the dog and herself during administration. Documentation. Accurately record the medication given, including the time and dosage, as part of the animal's medical records. This scenario aligns with our SPCA standards and animal health and welfare regulations, which mandate the proper administration of medication and careful monitoring of animals under care. What is the primary purpose of routine cleaning protocols in animal housing, and how can cleaning routines be adapted for different environments, e.g., kennels versus grooming areas? Answer: routine cleaning protocols in animal housing are essential for ensuring the health and well-being of animals by reducing the spread of disease, controlling parasites, and maintaining hygiene. Different animal environments require tailored cleaning routines due to variations in animal types, the frequency of use, and the risk of contamination. For example, kennels, which house animals for longer periods, require daily cleaning to remove waste, food remnants, and bacteria that could lead to disease transmission. These areas should also be disinfected regularly with animal-safe cleaning agents. On the other hand, grooming areas where animals are typically in and out may only need to be cleaned weekly unless there is a contamination risk. For these areas, cleaning agents should be chosen based on their ability to remove hair, oils, and dirt without harming the animal's skin. Additionally, the protocols should involve rotating cleaning agents to prevent microbial resistance. Relevant regulations. The cleaning and sanitation of animal housing and equipment are governed by local health and safety regulations, such as the Australian Animal Welfare Standards and Guidelines, which outline best practices for cleaning to ensure animal health and hygiene. How can improper disposal of biohazardous materials lead to environmental contamination, and what measures should be taken to prevent this? Answer: improper disposal of biohazardous materials, such as animal waste, contaminated bedding, and used cleaning agents, can lead to serious environmental contamination. These materials can introduce pathogens into the water, soil, or air, impacting both animal and human health. For instance, pathogens like E. coli or salmonella in improperly disposed waste can contaminate groundwater, and in some cases, airborne pathogens can spread through nearby communities. To prevent this, regulated waste disposal methods should be followed, including containment. Biohazardous materials should be stored in designated leak-proof containers until they are disposed of. Disposal. Waste should be transported to authorized disposal sites, such as certified waste facilities that handle animal byproducts. Sustainable practices. Implementing composting where feasible or partnering with specialized disposal services can minimize environmental impact. Mr. Smith is working in an animal shelter that uses cleaning agents to disinfect animal cages and feeding equipment. Recently, a few animals have shown signs of respiratory issues after the daily cleaning process. What should Mr. Smith do to address this situation and prevent further health concerns? Answer: Mr. Smith should first identify the specific cleaning agents being used and assess whether any of the chemicals could be irritating or harmful to the animals. It is possible that certain disinfectants, particularly those containing harsh chemicals like ammonia, bleach, or phenols, can release fumes that may cause respiratory distress in animals. Here's a step-by-step approach Mr. Smith should follow. Review product safety. Ensure that the cleaning agents are labeled as animal safe and do not emit harmful vapors or fumes. Increase ventilation. Enhance airflow in the shelter by opening windows or using fans to dissipate fumes during and after cleaning. Switch to non-toxic alternatives. If the current cleaning agents are problematic, switch to animal-friendly disinfectants that are less likely to cause respiratory irritation. Monitor animal health. Track the respiratory symptoms of the animals and consult a veterinarian to determine if the cleaning products are indeed the cause. Establish a protocol. Just cleaning schedules, perhaps switching to night cleaning when animals are not present to avoid direct exposure to chemicals. Why is the frequency of cleaning crucial in animal care environments, and what factors should influence how often different areas are clean? Answer: the frequency of cleaning is crucial to minimize the buildup of pathogens, parasites, and waste materials, all of which can compromise animal health. The frequency depends on several factors. Type of animal. Some animals, especially those with weakened immune systems or infectious diseases, require more frequent cleaning. Area of use. High traffic areas like kennels should be cleaned more frequently than less used areas like storage rooms. Risk of contamination. Areas where food or water is prepared or stored must be cleaned more often to prevent bacterial growth. Animal waste. Areas with animals that produce significant waste like poultry or large mammals should be cleaned more frequently to prevent disease transmission. Best practices. Kennels. Clean at least once daily, ensuring that all waste is removed and surfaces are disinfected. Food prep areas. Clean daily or after every use to ensure hygiene. Grooming stations. Clean weekly unless specific contamination occurs. What are the potential health risks associated with improper disposal of animal waste, and how can they be mitigated? Answer: improper disposal of animal waste can lead to a variety of health risks, including transmission of infectious diseases. Pathogens like Salmonella or parvovirus can spread through improperly disposed waste, affecting both animals and humans. Environmental contamination. Runoff from waste can contaminate water sources with harmful bacteria, leading to broader environmental and public health issues. Airborne pathogens. Decomposing waste can release odors and airborne contaminants that may affect respiratory health. To mitigate these risks, it is essential to implement proper containment of waste in sealed, secure bins that prevent leakage. Use authorized waste disposal services to handle and treat the waste appropriately. Ensure that all staff are trained in personal protective equipment (PPE) use when handling waste to minimize direct exposure to hazardous substances. What role does PPE play in the handling of animal waste, and what specific types of protective equipment should be used? Answer: personal protective equipment (PPE) plays a critical role in safeguarding workers from potential exposure to harmful pathogens, chemicals, and physical contaminants when handling animal waste. PPE is essential for preventing direct contact with waste and ensuring safe handling practices. The following types of PPE should be used: gloves to prevent direct skin contact with animal waste. Gloves should be worn, particularly disposable nitrile gloves for higher risk of exposure. Masks. When handling waste in an enclosed space, masks, especially N respirators, should be worn to avoid inhaling harmful particles or airborne pathogens. Gowns or aprons. Protective clothing helps avoid contamination of personal clothing. Goggles or face shields. These should be worn if there's a risk of splashing or contact with bodily fluids. Relevant regulations. The use of PPE in animal care settings is regulated by the Work Health and Safety Publisher in Australia, which mandates specific protective measures to reduce the risk of workplace illness due to exposure to hazardous materials. What are the benefits of maintaining accurate records of cleaning and sanitation practices in animal care settings? Answer: accurate record keeping of cleaning and sanitation practices serves several purposes. Ensuring compliance. It ensures that cleaning protocols are followed consistently as required by local health regulations. Tracking effectiveness. By documenting cleaning schedules and disinfectant usage, staff can monitor the effectiveness of their sanitation procedures and make necessary adjustments. Providing evidence. In the event of an inspection or audit, records serve as proof that sanitation practices are being adhered to. Health monitoring. It helps identify patterns, such as recurring illness among animals, that may indicate a breakdown in cleaning protocols. Relevant regulations. Records of cleaning and sanitation must be kept in compliance with local animal welfare legislation and occupational health and safety requirements, as they may be requested by authorities during inspections. How do sustainable waste management practices reduce the environmental impact of animal care operations? Answer: sustainable waste management practices such as recycling, composting, and reducing waste generation play a critical role in reducing the environmental footprint of animal care operations. These practices help in minimizing landfill waste. By recycling and composting organic materials, less waste ends up in landfills, reducing pollution. Proper waste segregation and disposal minimize the risk of contaminants reaching water, soil, and air. Energy savings. Some waste management practices like composting can help reduce energy use by promoting natural decomposition. Best practices. Establish waste segregation protocols to separate recyclable compostable and hazardous waste. Use composting for biodegradable materials like bedding and food scraps. Ensure regular audits of waste to track disposal and identify areas for improvement. What steps should be taken when introducing new cleaning agents or disinfectants in animal care facilities? Answer: when introducing new cleaning agents or disinfectants in animal care facilities, the following steps should be taken. Review product safety. Ensure the cleaning agents are labeled as safe for animal use, non-toxic, and environmentally friendly. Test for efficacy. Conduct trials to evaluate the effectiveness of the new product in eliminating pathogens without causing harm to animals. Follow manufacturer guidelines. Adhere to usage instructions for dilution, ratios, and application methods. Monitor animal health. Track the health of animals after switching to a new product to detect any adverse reactions. Training. Ensure staff are properly trained in the use of new cleaning agents, especially when introducing chemicals with different application methods. Relevant regulations. The introduction of cleaning products is subject to regulations set by the Australian Pesticides and Veterinary Medicines Authority (APMA), which oversees the safety of disinfectants in animal care settings. How does regular disinfection of waste disposal areas help in maintaining a healthy environment for animals? Answer: regular disinfection of waste disposal areas is essential for maintaining a healthy environment as it prevents the buildup of harmful pathogens that can spread to animals. Proper disinfection eliminates pathogens. Disinfectants kill bacteria, viruses, and fungi that can thrive in waste areas. Prevents cross-contamination. By regularly cleaning and disinfecting, the risk of waste contaminating other areas of the facility is minimized. Reduces odor and flies. Disinfecting also helps reduce unpleasant odors and the attraction of pests that can carry diseases. Best practices: clean daily or after each use to ensure hygiene and prevent any buildup. Use safe, effective disinfectants that are approved for use in animal care environments. Relevant guidelines. The Australian Animal Welfare Standards and Guidelines recommend that waste areas be disinfected regularly to prevent the spread of disease and to ensure a safe and sanitary environment for animals. What are some effective behavior modification techniques that animal care professionals can use to address behavioral issues in shelter animals? Discuss the advantages and limitations of positive reinforcement and punishment-based techniques. Answer: behavior modification techniques are essential in addressing issues such as aggression, fear, or anxiety in shelter animals. Some of the most common techniques include positive reinforcement. This involves rewarding desirable behavior to encourage its repetition. For example, rewarding the dog with a treat or praise when it sits calmly during a stressful situation. The main advantage of positive reinforcement is that it fosters trust and creates a bond between the animal and caregiver, improving the animal's behavior in a humane and effective manner. Limitations: over-reliance on food rewards can lead to dependency, and it can take time to reinforce certain behaviors, particularly for older animals or those with past trauma. Negative reinforcement. This technique involves removing an aversive stimulus when a desired behavior is exhibited, e.g. stopping a loud noise. When a dog stops barking, it can be effective but requires careful application to avoid reinforcing undesirable behavior. Punishment-based techniques. This includes applying an unpleasant consequence, e.g. spray bottle or loud noise, to reduce undesired behavior. While these techniques can suppress undesirable behaviors, they can also lead to fear, anxiety, and a breakdown in trust between the animal and its caregiver. Limitations. Punishment techniques can lead to negative emotional outcomes for the animal and may exacerbate aggression, anxiety, or fear if not used carefully. Effective combination: a balanced approach using positive reinforcement for teaching new behaviors and selective use of mild aversive techniques for correcting behaviors is often the most effective and humane method. How does proper nutrition impact the health and behavior of animals in a shelter environment? Discuss the types of diets appropriate for different species, e.g. dogs, cats, small mammals, and the role of animal care professionals in managing animal diets. Answer: proper nutrition is fundamental to an animal's overall health and well-being, influencing both physical health and behavior. In shelters, it is crucial that animals receive balanced and species-appropriate diets to support recovery, reduce stress, and encourage positive behavior. Dogs and cats. Dogs and cats require high-quality protein and fat for energy, growth, and immune system function. A balanced diet with appropriate proportions of carbohydrates, fats, and proteins ensures that animals maintain a healthy weight, coat, and energy levels. Special diets may be required for all the animals, those with allergies or those recovering from illness or surgery. Small mammals. Small mammals such as rabbits, guinea pigs, and hamsters have specific dietary needs. They require a high-fiber diet, Hey, to support digestive health, supplemented with fresh vegetables and fruits and limited quantities of pellets. Nutritional support. For shelter animals, stress and a lack of regular feeding routines can lead to health issues such as digestive upset or weight loss. Animal care professionals should monitor food intake, provide fresh food daily, and adjust diets based on individual needs. Malnutrition can lead to behavioral problems, including lethargy, irritability, and aggression. What are the main responsibilities of an animal care worker in maintaining proper hygiene in the workplace, and why is this important for both animal and human health? Answer: maintaining proper hygiene is essential for ensuring the well-being of both animals and workers in an animal care environment. The responsibilities include cleaning and disinfecting animal enclosures regularly to prevent the spread of bacteria, viruses, and parasites, washing hands thoroughly before and after handling animals or animal-related equipment to minimize the risk of transferring pathogens, sanitizing equipment, such as food bowls, grooming tools, and bedding to prevent cross-contamination between animals, ensuring proper waste disposal of animal waste to reduce the risk of contamination and the spread of zoonotic diseases. Proper hygiene is important because it prevents the spread of infectious diseases among animals and between animals and humans. Zoonoses. It helps maintain a clean, safe environment that promotes the health of both animals and workers. How should an animal care worker respond if they suspect an animal has ingested something toxic, and what are the immediate steps to take? Answer: if an animal is suspected of ingesting something toxic, the animal care worker should stay calm and try to determine what the animal ingested, e.g., plants, chemicals, food, prevent further ingestion by removing any remaining toxic substance from the area, if safe to do so. Keep the animal as calm as possible and avoid inducing vomiting unless instructed by a veterinarian or poison control. Contact a veterinarian or poison control immediately for advice on how to proceed. Provide information. If possible, provide the vet with details about the substance, the amount ingested, and the animal's condition. Relevant guidelines, regulations. Animal poison control centers provide immediate guidance on handling toxic ingestion in animals. Workplace Health and Safety Act requires employers to ensure staff are trained in emergency protocols, including responding to poisoning incidents. Explain the concept of a positive reinforcement and how it can be applied in animal handling to improve behavior. Answer: positive reinforcement is a behavioral training technique that involves rewarding an animal for exhibiting a desired behavior, thereby increasing the likelihood that the behavior will be repeated in the future. This method is based on the principle that behaviors followed by pleasant outcomes are more likely to recur. Examples of positive reinforcement include treats, giving a dog a treat for sitting or coming when called; praise, offering verbal praise such as good job when an animal responds appropriately to a command; toys or attention, using toys or providing attention when the animal behaves well. In animal care, positive reinforcement can be applied to train animals to follow basic commands such as sit, stay, or come, and also to reduce undesirable behaviors such as jumping or barking. This technique promotes a trusting relationship between the handler and the animal and is non-coercive, ensuring the animal's welfare. Describe how animal care workers can use environmental enrichment to improve the quality of life for animals in captivity. Answer: environmental enrichment refers to providing animals with stimuli that encourage natural behaviors, reduce stress, and enhance their overall well-being. In captivity, animals often lack the variety and complexity of the environments they would experience in the wild, leading to boredom, stress, and abnormal behaviors. Enrichment helps mitigate these issues. Key types of environmental enrichment include physical enrichment, providing appropriate space, climbing structures, and shelter that allow animals to express natural behaviors like climbing, jumping, or hiding. Sensory enrichment, introducing new smells, sounds, or visual stimuli such as scented toys, different textures, or visual changes in their environment. Social enrichment, allowing animals to interact with others of their kind if the species is social to prevent loneliness and depression. Feeding enrichment, hiding food in toys or puzzle feeders, or varying the types of food provided to encourage foraging and problem-solving behavior. What are the signs of stress or anxiety in companion animals, and what strategies can caregivers use to alleviate these symptoms? Answer: stress and anxiety in companion animals can manifest in various ways depending on the species. Common signs include behavioral changes, increased vocalization, e.g., barking or meowing; destructive behaviors, chewing, scratching; excessive grooming, or signs of aggression. Physical symptoms, lethargy, changes in appetite or eating habits; weight loss or gain; tremors or pacing; posture and body language. A stressed animal may exhibit lowered ears, a tucked tail, dilated pupils, or crouching. Cats may hide or show reluctance to interact. To alleviate stress and anxiety, caregivers should employ strategies such as environmental modifications. Providing a quiet, secure space with familiar items, bedding, toys can help. For animals prone to anxiety during events like thunderstorms, providing soundproofing or calming pheromone diffusers may be beneficial. Regular routine, consistency in feeding, exercise, and social interactions helps animals feel more secure. Positive reinforcement. Teaching coping behaviors through training can help reduce anxiety in situations that provoke fear. Gradual desensitization to stressful stimuli can also be effective. What are the key components of a balanced diet for exotic pets, and how do their needs differ from traditional companion animals like dogs and cats? Answer: exotic pets such as reptiles, birds, and small mammals have unique dietary needs that differ significantly from traditional pets like dogs and cats. Key components of a balanced diet for exotic pets include species-specific requirements. Different exotic animals have varying nutritional needs, including protein, calcium, and vitamin D levels. Fresh whole foods. Exotic pets often require a varied diet of fresh fruits, vegetables, and live foods, such as insects or small animals. Supplements. Some exotic pets require specific supplements, such as calcium for reptiles or vitamin C for guinea pigs. Inadequate nutrition can lead to metabolic or developmental disorders. Avoiding toxic foods. Many foods that are safe for dogs and cats, e.g., chocolate, avocado, garlic, can be toxic to exotic pets, so caregivers must be familiar with which foods are safe. Differences from dogs and cats. Unlike dogs and cats, which generally have more standardized dietary needs, e.g., commercial pet food options designed for them, exotic pets require more specialized care in terms of diet. What are the key principles of animal behavior that a veterinary nurse must understand to effectively handle animals during routine examinations and procedures? Answer: veterinary nurses must understand the following key principles of animal behavior to ensure safety and comfort for both the animal and the handler. Flight or fight response. Animals may exhibit a strong flight, escape, or fight defensive response when stressed or frightened. Recognizing this can help the nurse manage the situation before it escalates. Fear and anxiety. Fear-based behavior such as growling, snapping, or cowering is common during veterinary procedures. The nurse must identify these behaviors and respond with calming techniques. Body language. Observing tail position, ear orientation, posture, and facial expressions can provide insight into an animal's emotional state. Understanding these signs helps in adjusting handling techniques. Habituation. Repeated exposure to certain procedures, sounds, and smells can desensitize animals, making them more cooperative over time. Positive reinforcement. Rewarding animals with treats or praise for calm behavior can build positive associations with veterinary visits. What are the best practices for dealing with aggressive or fearful animals in a veterinary clinic setting? Answer: best practices for handling aggressive or fearful animals include assessment of behavior. Observe the animal's body language before attempting to handle it. Look for signs of aggression such as growling, baring teeth, or tense muscles, and signs of fear like trembling or cowering. Environmental modification. Minimize stress by reducing loud noises, sudden movements, and unfamiliar smells. Dim the lights or play soothing music to calm the animal. Use of restraint. Apply gentle but firm restraint techniques that prioritize the safety of both the animal and the handler. Consider using muzzles for aggressive dogs or soft harnesses for fearful cats. Chemical sedation. If the animal's aggression or fear is extreme, the veterinarian may decide that chemical sedation is necessary. The veterinary nurse must be ready to administer sedatives under the veterinarian's guidance. Non-physical approaches. Use verbal calming techniques, such as speaking in a soothing tone, and offer the animal treats or praise for calm behavior.